that when I hold him or look at him and I think about him, that I don't feel the pain and I don't realize the effect that my alcohol drinking, the drinking of the alcohol, had on his little body, and that it has caused him so much pain. He's had physical problems. His facial features are not like they should be because of it. And there's not a moment or a day that goes by that I don't feel remorse and guilt over that.
More than 5% of the 4 million women who gave birth in the United States use illegal drugs while they were pregnant. An estimated 113,000 white women,
75,000 African American women,
and 28,000 Hispanic women used illicit drugs during their pregnancy.
The moment you take that first drink, you are directly affecting the fetus. Alcohol crosses the placenta almost immediately after ingestion. One of the most serious consequences of drinking during pregnancy is a chance of having a spontaneous abortion.
Fetal alcohol syndrome has 3 components to it. One component, and when I say fetal alcohol syndrome, I mean the disorder that happens in children because their mothers drank. So while the babies were still inside the mother's wombs and were developing, they were exposed to alcohol. They were kind of bathed in alcohol. Their brain and their body was being bathed in alcohol during this early growth. And there are 3 parts to the syndrome. One of the major parts is that the children are small. They're small at birth, and they stay small through most of their life. Their head is small, and that reflects that their brain is small. And those children referred for me to evaluate because they have a condition that we call failure to thrive, which means that they're not growing and actually not developing. The second thing that happens to children who've been exposed in utero to alcohol is they have developmental problems. They're slow learners. They're hyperactive. They can't sit still. They fidget a lot. They're easily distracted. They have a very hard time in school attending to what the teacher is saying. And then the third component is that their face is affected by the alcohol, and they have certain very distinctive facial features. They're not funny looking, but they're very distinct. One thing is that they have a very thin upper lip with a very long area between the nose and the upper lip, an area we call the philtrum. They have small eyes, a condition we refer to as microphthalmia. They have these long eyelashes and they have droopy eyelids, something that's called ptosis. They have a very flat bridge to the nose with an upturned nose and a small head. Those are the 3 major categories of problems that children who've been exposed to alcohol, children who have fetal alcohol syndrome, manifest.
At some point during their pregnancy, 20.4% smoked cigarettes and 18% drank alcohol.
From the 2nd to the 8th week following conception, alcohol can damage the brain and other vital organs.
It's a common belief that the 3rd week of pregnancy will show the most severe signs of fetal alcohol syndrome.
Partying can often lead to sexual promiscuity. Oftentimes, the teen is unaware of being pregnant and continues to smoke and drink and do drugs. But now this behavior is affecting the baby as well, in a big way.
I think it may be hard to imagine if you're pregnant that things you put in your body are going to affect your baby. But think of it this way, would you take your 1-day-old, 1-week-old, or 1-month-old and give them a beer to drink? Or give them a glass of wine or something like that? You'd never think of doing that. That seems ridiculous. Wouldn't give them a cigarette to smoke. But when you do that during pregnancy, when you drink, when you smoke, when you do drugs, that goes from your system directly into the baby's system. And in some ways, it's even worse than giving your baby beer after they're born, because the baby system is just developing. Their brain is developing, their nerves are developing, their whole body is developing. And their body was not meant to develop in a sea of alcohol. It's just going to have a very, very bad effect. So before you take that drink, pretend you're handing it to your baby and decide, do I want my baby to be drinking this? Do I want my baby to be exposed to this? Give your baby a chance to have the best start in life.
Cameron has been diagnosed with fetal alcohol syndrome. He is fortunate to have been adopted by loving parents and shares in that joy with his new brothers and sisters. But it was no easy task getting there. Linda explains.
Cameron was diagnosed with fetal alcohol syndrome and failure to thrive. And when we got it, he had speech delays. There was no communication. And so luckily we're fluent in sign language. So we started teaching Cameron sign language, and that helped a lot with the communication, because if he wanted something and we didn't guess it right, it would throw him into these big temper tantrums that took hours and hours to help him get through them and get over them. But once we taught him sign language and we got the communication down, it made it so much easier. And then from then on, he goes to speech therapy, and once his speech kicked in, we found out he also needed tubes in his ears, and once we got those done, that helped a lot also. He was able to hear better. And once we got the communication down, things were a lot easier. He went to a preschool for special needs children, and he gives 100% to everything that he does. And so he really has learned quickly and has just amazed his teachers at how well he's been developing.
Low birth weight, mental retardation, and behavioral deficits are being manifest from the 8th week until birth as a result of exposure to alcohol.
When we got Cameron at 2.5, he had some emotional problems or frustrations that I think might relate to where he had been and what had happened to him. But when we put him to bed at night, we couldn't turn off the lights, we couldn't shut the doors, or he would jump out of bed screaming and yelling. And if he didn't get his way, or if we didn't understand exactly what his needs were, he would throw himself on the floor, and he would hit his head on the floor, and a few things like that.
How the mother treats her body during pregnancy will affect the physical, emotional, social, and educational development of the child for the rest of their life.
Many times we have children who have a lot of anger in themselves, and we really have to deal not only with the educational plan for them, writing the individual educational plan, but we have to deal with the neurological, and we have to deal with the counseling aspects of it, because many times they don't know why they're frustrated. And I'm going to tell you a story about a young man I'm going to call Stephen. It's not his real name, but Stephen becomes so angry at times that he wants to strike out at others. He comes to school, nothing's happened. He doesn't know why he's striking out, but he comes into the classroom and he can sit for a few minutes, and then he's kicking under the table or hitting. He comes from a home environment where he has not had the best situation because the parents are still continuing to work to overcome their problems with alcohol and with the fetal alcohol syndrome. So they're working with him, but they're also working with themselves. And he comes in with this frustration and anger. And the main way that we work with Stephen is to give him a timeout. And we have a timeout place in the classroom to where he knows he can go, and that's a safe spot for him. He can go and find himself and talk through and talk one-on-one with another person. And sometimes we have to hold them, what we call a love hug, because they are to the point. They are so angry and frustrated that they just have to strike out at someone. And we have to look at the safety of the other children. Stephen has done this on many times, and he has hit many children and kicked many children, but we're still working with him. We try not to suspend from school. We try to work on those problem behaviors. And we keep talking and reinforcing it. And he'll tell us, Stephen will tell us, I have a bad side and I have a good side. You don't want to see the bad side of me. You want to see the good side of me. And he knows that he's doing wrong when he does it, but he says, I can't control it. I don't know what causes me to do this. And so we're looking at all aspects of the behavior. We're looking at the educational aspects of it, the neurological, and we're working with the counseling part of it. And we stay very much in contact with the professionals that deal with this and work back and forth. And we also have Stephen involved in small group therapy to where he can work it through and talk it through.
I've been reading up on fetal alcohol syndrome and the effects that it has on kids, and how it does cause developmental delays, and that they can only learn up to a certain point, and then they're not able to learn anymore because they get hyperactive and overactive and stuff, and how they become frustrated, and that when they get in their teens, that sometimes they become violent. And those are concerns as us as a family, because we don't know how severe that can be. And you know, it's scary to know that some of these little kids they don't have a choice of what they're going to be when they get older. They're guided into by, you know, the effects of fetal alcohol.
While the birth mother is clean and sober now, she is constantly reminded of the wreckage of her past and the effect it had on her baby. She shares her experience with the hope that her message will deter other young girls to abstain from drugs and alcohol, not only while pregnant, but for life. Because while pregnant, you really are drinking for two.
I didn't know I was pregnant for the first 3 months when I was, and I drank heavily. I was really surprised, and I was shocked, and I was terrified when I found out that I was pregnant. I talked to one of my sisters, and she said, oh, don't worry. I was pregnant, and the first 3 months, I didn't know I was pregnant either. I drank so heavily, even did cocaine. And my child was just fine. So that gave me some relief, and I felt a little bit better. And then I thought, well, if I don't say anything to anyone and I just do it once in a while, I drink once in a while, like special occasions, maybe on Christmas or New Year's or some birthday party, that'll be okay. Because after all, didn't people do that 40 years ago, and everyone else's children, they were just fine. All this fetal alcohol syndrome and this big thing about it, I didn't really think it was that big of a deal. I saw that my sister's baby was fine, and I also saw that there were several other people I had talked to who smoked and they drank throughout their pregnancy, even did drugs, which I looked at and I said, well, maybe it's not that bad. It's probably just they're making a bigger deal out of it than it really is. I ended up having a child that was greatly affected because of my drinking. And there's not a day that goes by that I don't feel the pain. That when I hold him or look at him and I think about him, that I don't feel the pain, and I don't realize the effect that my alcohol drinking, the drinking of the alcohol, had on his little body, and that it has caused him so much pain. He's had physical problems. His facial features are not like they should be because of it. And there's not a moment or a day that goes by that I don't feel remorse and guilt over that. It's caused a lot of problems in my life. Now, luckily, my son has been able to integrate into regular school. He's at the grade level he should be for his age. His size is smaller than he should be, and that has a lot to do with the fetal alcohol syndrome. He's the most lovable, sweet little boy that you would never know. And it's really good that he has such a good attitude about his appearance. Now that he's getting a little older and he's around other people, he's starting to realize that he looks different. And he asks me things about that, and it causes me great pain. He does know that Mommy was sick. I had a lot of problems, and he knows that drinking is bad. He doesn't know, I don't believe at this point in time, that it was because of my drinking that he appears the way he does, but he will know. And there will be a day when we will have to talk about that. And that's okay. I have a good relationship with him. Because of my drinking, I lost my rights to him. My rights were terminated. The courts don't look very kindly upon someone that has caused a child to have fetal alcohol syndrome because of their drinking, because of their abuse of alcohol or drugs. And whether you realize how sick you are or not is not going to make it okay. You need to get help, and you need to not listen to other people when they say, oh, it's okay, I drank through my pregnancy, oh, it's okay, my child is just fine. Even if the child looks okay, he has been affected in his learning ability, his comprehension, the way his memory is, the way he functions. Whether or not you can physically see the problem because of fetal alcohol syndrome or not, that's not, it does affect them, and I know that firsthand.
Reduction in birth weight places babies at risk for infections and developmental delays, and even death during infancy, meaning death up into the first year of life.
Another condition that babies are at risk for is something we call SIDS, S-I-D-S. It stands for Sudden Infant Death Syndrome. People commonly refer to it as crib death. And it's where a perfectly healthy baby, usually between the ages of about 1 month to 6 or 7 months of age, just stops breathing and dies. While we don't know what causes SIDS, we do know certain things are associated with a higher incidence of SIDS. Maternal drug use is associated with a higher incidence of SIDS.
Nicotine is a serious problem as well. Women who smoke during pregnancy don't realize that nicotine in tobacco causes increased heart rate and vasoconstriction in the smoker and affects the fetus as well.
Maternal smoking is associated with a higher incidence of SIDS. And that's not just smoking while you're pregnant, but having anyone in your household smoke around the baby. So imagine what it would be like to have fed your baby at around midnight, put your baby to bed, thinking the baby is perfectly fine, and awaken at 5:30, 6 o'clock the next morning to find that your baby is blue, lifeless, and not breathing. That's the sudden infant death syndrome.
If the mother contracts HIV or the AIDS virus, it is possible the baby may also have it. Mothers can come in contact with the HIV virus by sharing needles contaminated by the HIV virus, blood transfusions, and sexual contact.
What about the guys? It's important for the father to stay drug-free to ensure the health of the baby. A man needs to provide support and caring for the mother, including helping her protect the baby's health by not using drugs. Drugs can affect the sperm.
Cocaine causes significant damage to the fetus. It affects the fetus by constricting blood vessels, increasing heart rate, decreasing oxygen flow, and ultimately creating an erratic heart rate.
What happens to babies who've been exposed to drugs? Well, right after birth, you can see that a baby who's been exposed to drugs is no longer receiving those drugs. And that baby's little body becomes addicted the same way that an adult would be. And when there are no drugs around, the baby's body will go through withdrawal. The withdrawal can be manifest by the baby shaking, be very, very nervous and tremulous, to the point that the baby could have a seizure. The babies will have trouble eating. They can't coordinate their swallowing and suck, and may throw up and have diarrhea. They may be very irritable and move their arms and legs to the point that they rub the skin off their elbows and their knees. They sneeze, they salivate, and they cry and are very irritable because they're going through drug withdrawal. You wouldn't want your baby to have to experience that. If your baby does, the doctors may have to give you baby drugs to quiet them down. Not a good way to start your life. Now, sometimes you'll be doing drugs and you don't even realize that you're pregnant. You have a boyfriend, you're having sex, your periods have maybe always been a little bit irregular. Be aware of your body. Take care. Treat your body well, even before you become pregnant, because the state of your body before you're pregnant, how well nourished you are, how well rested you are, also will affect your baby once the baby is growing within your body. So be aware of yourself and treat your body well, thinking that you might, because of your activities, become pregnant at any point in time.
While alcohol is the most frequently used drug, marijuana is a close second. Marijuana crosses the placenta and directly affects the fetus. It is now known that women who smoke marijuana have shorter and more complicated pregnancies. The babies tend to be born smaller and may have difficulty breathing.
What happens if you didn't realize you were pregnant and you partied all night and really drank, well, probably more than you should have, even if you weren't pregnant? We know that binge drinking can affect babies, that it will affect their development and their size. But once you stop drinking and once you stop doing drugs, from then on, that baby is in a good and safe environment. So I wouldn't necessarily say, my goodness, I drank, I partied, my baby is doomed. No, that's not true. From that moment on, make the decision to live healthy, not to take drugs, not to drink, to eat good, and that will have a beneficial effect on the baby. You don't ever want to binge, but if it happens, you can move forward.
It's never too late. Fetal alcohol syndrome is preventable. Please give your baby a chance for a fair start in life.
The problem was that when the baby was born, I had so much guilt over it, I relapsed. And it has been a very hard thing for me, because no matter how long you're sober or clean, people don't ever forget, and they always look upon you as someone that has done this to a child. And you have your own feelings about it, and you judge yourself. You are the one that judges yourself the harshest. But when you have everyone around you and people especially that come into your life and there's new relationships, it's very, very hard for you to go on and to cut the past out of your life so that you can start anew, especially when you've always got your child here that has been affected, and he is going to grow up with these problems because of your selfishness, because of the fact, well, I call it selfishness, but I know it is also a sickness. You have problems, you need help. I got help. And if you know that you're drinking and you're hiding it or you're not honest, get help.
Shame and fear play a large role in the lack of seeking out prenatal care. Even a strong denial can set in at first, which complicates the situation.
There are many, many options. that somebody has, and there are clinics and organizations to help you decide on the right path of action for you, whether you decide to go to term with the pregnancy, to keep your baby, to have help from your family with your baby, to put your baby up for adoption. They're all opportunities for you.
I talked to a counselor on fetal alcohol syndrome, and I was told that on some people, just 1 or 2 drinks can damage the fetus enough that they'll be born with fetal alcohol syndrome. And then there's some that can drink through their whole pregnancies and they don't seem to see any signs at birth, no visual signs. But once they hit kindergarten and they start having to learn, and they do have mental limitations, you know, you just have to remember that it's just not you. That there's another life, and it's just not worth the chance. You know, if you're pregnant, just stop what you're doing. And if you do have a problem, there's people out there that want to help.
Your baby can't speak for itself, and what choices the mother makes may bring on lifelong damage unless the mother stops. Abstinence is the best way to count on having a healthy baby. However, stopping at any time during pregnancy can reduce the health risk for the unborn child.
He'll go home tonight, Stephen will, and maybe he'll go home to a very disorganized house, or he may go home to a day that is very positive. Because at home, they take it day by day what they're doing with their youngsters. The parents are receiving training also as to how to work with their situation and their home situation to where they can build a positive, loving home. And that's what's really important with this type of child, is that they have the security and the love surrounding them, that they have the positive environment. And that's some of the things we have to think about once a youngster is damaged with fetal alcohol syndrome, because it's going to go on throughout their life, and it's irreversible. We can reteach, we can retrain, but that damage is irreversible.
Don't be afraid to ask for help. Most people addicted to drugs and alcohol need professional help, and there is help out there. Encourage her to talk to someone who can help her out with her pregnancy. Better yet, tell some responsible adult who you trust who can help her out without getting her into trouble. Encourage her to talk to her parents. Remember, you're dealing with 2 lives.
Fetal alcohol syndrome does not only affect the immediate family, but society as a whole. You now know the damage that the alcohol and drugs can do to the fetus. Fetal alcohol syndrome is preventable.
You just have to remember that it's just not you. That there's another life, and it's just not worth the chance.